2015 while on day release from a different hospital run by what was then the North Essex Partnership Trust. Deborah Coles is here from the charity Inquest, which contributed to a Care Quality Commission inquiry into hospital deaths at the end of last year. And Sean Duggan is the Chief Executive Officer of the Mental Health Network, which represents NHS mental health trusts. And Tanya has joined us too. It's not her real name. She's a former nurse who worked at the Linden Centre. Tanya, thank you very much for getting in touch with us. Tell us your own experience.
Hi.
Hi.
I just want to say firstly, obviously, this doesn't relate to all psychiatric nurses across the area. We have a really, really hard job. My experience dates back to when the Linden Centre first opened, and I worked there. I pointed out on various occasions that there were many very flaws where people could self-harm. In fact, I now suffer from post-traumatic stress after a violent incident, after discovering someone who had died, and I have therefore not worked since, really, and have been ill myself. I had absolutely no support. The day we had a debriefing, the day after the incident, a consultant cavalierly said, we've had to, as long as we don't have we've met our match.
I'm really sorry, I didn't hear the last sentence. As long as what, sorry, Tanya?
We had no more than 3 deaths, we've met our quota.
As long as it had no more than 3 deaths a year?
Yeah.
Whoa.
And in fact, I'm waiting to go to the doctor now. I've only just come out of hospital myself recently, again, after trying to take my own life. But because I was in hospital, it reminded, the smells and everything reminded me so much of the Linden Centre that it wasn't doing me any favours in there.
Okay. Tanya, thank you very much. Thank you for getting in touch with us.
Not all nurses are bad, though.
No. Oh, my gosh. Absolutely, yeah. That goes without saying. Thank you. Thank you very much, Tanya. Well, Essex Partnership University NHS Foundation Trust, which was the North Essex Partnership NHS Trust at the time of the deaths, told us the history of serious incidents of self-harm at the Linden Centre is a matter of great concern that the Trust has already recognised must be addressed. Before I talk to Sophia and Deborah and Sean, let me tell you that President Trump has landed in Israel, and we may interrupt our conversation to show you live pictures. Okay, Sophia, tell us about your mum's depression.
Well, it got worse in about 2013, but it had been ongoing and never really diagnosed as exactly what it was. But recurrent depressive disorder, definitely depression. And she did attempt suicide in 2013 and then was in the hospital until 2015 when she did commit suicide on day release.
And the Trust have investigated the circumstances. Have you had the outcome of that report yet?
Well, there was one serious incident report that was found to be inadequate, that caused a lot of stress and went on for a long time, wasn't really independent. That was investigated by Verita, seemed to be not adequate for purpose, which also impeded on the inquest, because then we had no serious incident report to take to the inquest, so we had problems there. And they were just going to leave it at that and say they learnt lessons, but we insisted that they redo the inquest, the serious incident report, to make sure that it was done properly, to make sure they could actually do it. So we're still waiting, and we've just actually been put back again on it. So we wrote a big complaint, which now hopefully we're going to meet with someone higher up in the Trust to see why they can't even do a serious incident report.
Right. Deborah Coles, how shocking is it that this number of people have been able to take their own life at a particular centre run by one mental health trust?
Well, I think the families summed it up. You expect to go into a mental health setting and be safe, and for repeated deaths to happen in similar circumstances, to me, highlights the fundamental problems with the way in which these deaths are investigated, the fact that they are not independently investigated, families are very often not involved, but importantly, it shows a shocking lack of learning and accountability, and a failure of governance and leadership. And that, I think, also begs questions about the regulator, the Care Quality Commission.
Well, they did put forward various recommendations for this particular trust to improve, didn't they?
Yes, they did, but you have to then monitor and ensure that those recommendations have actually been implemented. And I think that is the biggest frustration and distress from families, to know that they've suffered a death, they hope that action will be taken to prevent similar deaths, only then to find out that another person has died in almost identical circumstances. So there are questions across the NHS and for the CQC as to how the situation at Linden Hospital in particular was able to happen.
Sean Duggan, what is the situation with staffing in mental health units?
The situation of staffing in mental health units varies across the country. In some areas they're well off for staff and they have the required amount of nurses, doctors and support staff for them, and in other parts they're finding it really difficult to recruit. So workforce is an incredibly challenging issue for mental health trusts across the country. But if I could
But some are understaffed.
And some understaffed, some are using more agencies than we would like. The balance between that is really important. If you've got permanent staff that know patients very well, that's obviously something we would strive for. But if I just explain a little bit about the mental health context, because I think it's really, really important to sort of set the scene and how we resolve things in moving forward. It's known that for decades mental health has been an underinvested part of the health sector in total, and that's successive governments. 3 years ago there was an independent task force around mental health that was to look at issues such as this, prevention of suicide, better mental health care for children, etc. And that came up with a 5-year plan, a 5-year forward view. We're 2 years into that. There's some investment in that. There's been some difficulties in getting the money and the investment into NHS Trust to provide better services, but it's now starting to come through. We have to see, for the next government, it's absolutely essential that that is committed to and the investment goes through, because it's linked directly with workforce. If there's a lack of money, of course, it's more difficult to get the workforce right in NHS Trust. Now, this is not going to be a reassurance to Sophia, and I'm sorry about that, but that's the sort of the context of mental health.
Let me read an email from Cassie who says, I spent a brief amount of time in the Linden Centre 4 years ago. They saved my life, and I cannot fault their care or the environment I was in. I feel incredibly sad for the families who've lost loved ones. And although the centre should be a safe place, it will not stop someone determined to end their life. They will do anything they can. Sandra texts to say, my son was admitted to the Linden Centre on several occasions.